Idaho has so much to admire. Ask any resident, and they'll talk about the Panhandle's lakes and mountains, the capital city in the south, or the spectacular beauty of the Sawtooths. Idaho residents refer to their state as paradise, and for more reasons than the inspiring landscapes. Idaho offers an unbeatable quality of life, good jobs, a reasonable cost of living, and an excellent, yes, excellent system of public health districts. Public health makes a difference in the lives of all Idahoans every day. No wonder other states admire and try to learn from Idaho's public health districts. Wait a minute, you're not sure just exactly what public health is? You're not alone. If you're like most people, you know public health is important in your life, but you're not quite sure how and where it fits. You deserve to understand the full story of anything that plays such an important role in your life. Let's start with the basics. Public health is the practice of protecting, maintaining, and improving the health of communities. Public health defends you from any health threat, regardless of the source, and works tirelessly to prevent disease outbreaks. Have you wondered why epidemics are so few and far between? It's because public health's priority is to stop the spread of disease and the discomfort, disability, and premature death often associated with it. For example, public health has virtually eliminated polio, saved lives and early detection of breast cancer, reduced falls among the elderly with strength and balance training, and improved oral hygiene for underinsured children. Public health works toward less costly pregnancies, healthier babies, and healthy lifestyles for families. It protects against hazards at work, at home, and in the environment. And it prepares for and responds to disease outbreaks and other public health emergencies. If you're thinking it's a big job, you're absolutely right. Now that you know what public health is, you'll understand how lucky you are to live in Idaho. Idaho public health districts reach every corner of the state. Their excellence is recognized by the National Association of County and City Health Officials. In 1970, Idaho's legislature recognized the value a formal public health structure would provide Idaho residents. That year, the legislature created 7 health districts to ensure that all Idahoans have access to local public health services. Each district covers a group of counties. The health districts share a common vision: healthy people in healthy communities. They focus on local needs, but their ultimate goals are the same: to prevent disease, promote healthy lifestyles, and protect the health and quality of the environment. Local management is important to understanding local needs, so the legislature made it clear that the state's public health services will stay locally controlled and governed. County commissioners in each health district appoint a board of health that governs the district's policies based on its unique local needs. For example, all 7 districts offer immunizations, but only a few offer nursing services in local schools. The health districts aren't state agencies. They're single-purpose districts, like school and highway districts, with a specific job: to protect the public's health. Each district is accountable to its Board of Health. Funding for the health districts was a puzzle, but legislators zeroed in on a logical plan. To solve the puzzle, the state entered into a partnership with its counties to provide basic operating funding to the 7 health districts. Other revenue sources include fees from clients and grants and contracts with federal and state agencies. The legislature approves only the state's portion of funding that goes to health districts. The counties within each health district are responsible for setting and approving their district's overall budget. It was quite a feat creating Idaho's excellent public health structure, and state residents just like you have benefited ever since. Idaho Code outlines basic services health districts are expected to provide. These services vary by district according to local needs, but generally fall into 5 broad areas. Have you ever gotten sick after dining out or playing in a public pool? Idaho public health districts are the public's front line of defense against infectious disease outbreaks. Idaho keeps a list of more than 70 infectious diseases that are reportable to the health districts. Once an incident is reported, public health epidemiologists, the disease detectives, start to investigate. These diseases keep public health investigators busy year-round. They investigate the source of illnesses like tuberculosis or salmonella, and educate the community on how to protect itself from the exposure and spread of diseases. Health districts share the information gathered in disease investigations directly with state and federal agencies, as well as with local medical facilities and infection control practitioners. Have you taken a smoking cessation or senior fitness class through your local health district? Public health educators actively recruit students to improve their health. They work with teens, adults, and pregnant women to discourage tobacco use. They also offer tobacco cessation programs. These educators teach clients to prevent and control chronic diseases such as asthma and, for some, cancer. In the United States, falls are the leading cause of injury deaths among older adults. There are Idaho seniors active again for the first time in years, thanks to the strength and confidence they've developed through health district fitness classes. Dental hygienists are public health educators who teach oral health and help reduce dental decay with fluoride varnish programs. Idaho parents who bring their children in for immunizations can feel confident that their kids are well protected from the serious consequences of once common diseases such as measles, mumps, and diphtheria. Public health nurses immunize to protect communities from disease. They test for and treat sexually transmitted diseases and promote safe and responsible reproductive health. Infants and toddlers benefit from nutrition counseling when their parents bring them in for appointments with the Women's, Infant, and Children program. Public health professionals raise awareness about breast and cervical cancer, and in some districts screen for these diseases. They also link patients to resources and medical programs. If you own a restaurant or have applied for a septic system permit, then you're familiar with district environmental health specialists. These highly trained professionals prevent disease by managing the environment around us. These are the people who inspect food establishments for safe food handling practices. Environmental health specialists inspect restaurants and markets to see that food is kept at the right temperature, prepared safely, and that food handlers wash their hands. Environmental health specialists also inspect child care centers to see that the facilities operate with the children's safety and health in mind. These specialists monitor small public water systems and inspect sewage disposal systems to prevent contamination. They inspect and approve solid waste facilities. Environmental health specialists review subdivision plans for proper sewage disposal and adequate drinking water. They conduct site evaluations. The Public Health Preparedness Team works to develop a comprehensive, round-the-clock emergency response plan. This helps communities prepare for the threat of natural disasters, terrorism, or global disease outbreaks like pandemic flu. The preparedness team helps communities improve their readiness through partnerships with emergency responders. Idaho was the first state in the nation with all its public health districts certified as public health ready in an emergency. Preparedness is one of the many federal programs the State Department of Health and Welfare contracts with local public health districts to deliver. Idaho benefits from federal programs such as immunizations, responsible reproductive health planning, disease investigation, and tobacco cessation. Program dollars flow from the federal to the state level and then to the health districts. The state contracts with local public health districts because these programs are more effectively delivered locally. The partnership works well for the entire state. Now that you know the whole story behind Idaho's public health districts, you'll agree that you're fortunate to live in a state that strives to provide a top quality of life for all of its residents. When you think about it, public health is a cost-effective investment that pays off in healthy dividends. In Idaho, your public health district is there for you whenever you need it. It's all about health all the time. Healthy people in healthy communities.